Benzodiazepines, commonly referred to as benzos, are a class of psychoactive drugs that are frequently prescribed to treat a range of conditions, including anxiety, insomnia, muscle spasms, and seizures. While benzodiazepines can be effective in managing these conditions, they also come with a host of risks and potential side effects that should not be overlooked. In this comprehensive guide, we will explore the dangers of benzodiazepines, common side effects, and strategies for safe use and management. First and foremost, it's important to understand how benzodiazepines work and why they can be risky. Benzodiazepines act on the central nervous system to enhance the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, which has a calming effect on the brain. By increasing GABA activity, benzodiazepines can help reduce anxiety, promote relaxation, and induce sleep. However, the very mechanisms that make benzodiazepines effective can also lead to dependence, tolerance, and withdrawal symptoms with prolonged use. Benzodiazepines have a high potential for abuse and addiction, especially when taken in higher doses or for longer periods than prescribed. Tolerance can develop over time, requiring higher doses to achieve the same effects, which can increase the risk of overdose and other adverse outcomes. Moreover, abrupt discontinuation of benzodiazepines can trigger severe withdrawal symptoms, including anxiety, insomnia, irritability, agitation, tremors, muscle cramps, nausea, vomiting, and even seizures in severe cases. Withdrawal symptoms can be debilitating and may require medical intervention to manage safely. It's crucial for individuals who have been taking benzodiazepines to taper off the medication gradually under the guidance of a healthcare professional to minimize the risk of withdrawal. In addition to the risks of dependence and withdrawal, benzodiazepines can also cause a range of other side effects, especially when taken in higher doses or in combination with other substances. Common side effects of benzodiazepines include drowsiness, dizziness, confusion, memory impairment, poor coordination, blurred vision, slurred speech, and slowed breathing. These side effects can impair cognitive and motor function, increasing the risk of accidents, falls, and other injuries. Furthermore, benzodiazepines can have interactions with other medications and substances, including alcohol, opioids, and certain antidepressants, which can amplify their effects and increase the risk of overdose and respiratory depression. Combining benzodiazepines with other central nervous system depressants is particularly dangerous and should be avoided. Special caution should be exercised when prescribing benzodiazepines to certain populations, such as older adults, individuals with a history of substance abuse, and pregnant or breastfeeding women, as they may be more susceptible to adverse effects. Benzodiazepines can increase the risk of falls and fractures in older adults, and there is evidence to suggest that prenatal exposure to benzodiazepines may be associated with adverse outcomes for the fetus, including withdrawal symptoms in newborns. Given the risks associated with benzodiazepines, it's important for healthcare providers to exercise caution when prescribing these medications and to explore alternative treatment options whenever possible. Cognitive behavioral therapy, CBT, relaxation techniques, and other non-pharmacological interventions can be effective in managing anxiety and insomnia without the risks of benzodiazepines. For individuals who require benzodiazepines for the management of acute anxiety or insomnia, it's important to use them judiciously and as prescribed. This includes taking them at the lowest effective dose for the shortest duration necessary to achieve the desired therapeutic effect. Regular monitoring and reassessment are essential to ensure that benzodiazepines are being used safely and appropriately. In conclusion, while benzodiazepines can be effective in managing certain conditions, they also come with a range of risks and potential side effects that should not be overlooked. Dependence, tolerance, withdrawal, and other adverse effects are common concerns associated with benzodiazepine use, and special caution should be exercised when prescribing these medications, especially to vulnerable populations. By understanding the risks of benzodiazepines and exploring alternative treatment options, healthcare providers and individuals can make informed decisions about their use and minimize the potential for harm.